we'll get started, and then other folks can join as they come in. So oh my goodness, can you hear me now?
Yeah,
So
we can hear you now. Yeah,
okay.
But we did lose your screen share.
Okay, great. I will reshare that screen. I'm sorry about that. Not sure what happened there. There we go. So did you all hear my recording announcement? No.
Yeah,
okay.
we got the recording announcement.
Okay, great. Well, we will be recording today, just so everyone's aware. We'll get started, and then folks can pop in as they do. So welcome everybody to Unpacking the Process. Today we're going to be talking about how to influence HIV policy in the Biden-Harris administration, and really just kind of giving like a basic overview of like what are federal agencies and that affect HIV law and policy, and like what do they do and how can we get in there and change some things. So we are lucky enough today to have some really amazing presenters. We have Nana Khanna here. She's PWN's co-executive director along with Vanita Ray. Nana has worked in the HIV field since 2005 as a speaker, trainer, advocate, following her HIV diagnosis in 2002. Currently, she serves on the board of directors for AIDS United, the National Steering Committee for the U.S. People Living with HIV Caucus, and is also a member of the Women's HIV Research Initiative. Previously, they served on President Obama's Advisory Council on HIV and AIDS. We'll talk about PACHA later, so if you don't know what that is, get ready to learn. And prior to that, prior to working in HIV, Nana co-founded and served as the National Field Director for the League of Pissed Off Voters, which is a progressive national organization working to expand the participation of young people and communities of color in electoral politics. We're super lucky to have Ronald Johnson here as well, who has a really long legacy of advocacy for people living with HIV. Ronald is currently the chair of the U.S. People Living with HIV Caucus and has worked through multiple administrations at the federal level in developing responses to the HIV epidemic. Ronald's also worked a lot in developing responses to the HIV epidemic in New York State and Washington, D.C. Also a former member of the Presidential Advisory Committee on HIV and AIDS in the Clinton administration. So hopefully if anyone has questions on that, Nana and Ronald will be able to answer them for you. My name is Allie Watson. I use she, her pronouns. I'm the Positive Women's Network, If, When, How, HIV and Reproductive Justice Fellow. I'm a lawyer by training, and now I do policy work with Positive Women's Network. So for those who, skipped ahead too much. For those who don't know, Positive Women's Network is the only nationwide organization in the US led by and for women and women of trans experience living with HIV. And we are inclusive of non-binary folks as well. We were founded in 2008 by 28 diverse women living with HIV, including women of trans experience, and have really grown since then to over 3,000 members nationwide. Really a nationwide organization. We have, I think, 6 chapters and then state leads in another 12 states. Our mission is to prepare and involve women, transgender, and non-binary folks living with HIV in all of our diversity in all levels of policy and decision-making, which is part of why we're here today. Because part of including and involving folks living with HIV in policy and decision-making is that complicated.
I think Allie froze. Hey, Allie, I think you froze a little bit.
Oh no, can you hear me now?
Yeah,
Yes.
But you are freezing a little bit, just FYI.
Okay.
Yeah.
Maybe I'll stop my video. Is that helpful?
Yeah, let's try that.
Okay, great. I'm sorry about that. I don't know what's going on. No worries.
Um,
To go into some of our objectives today. Federal administrative advocacy can be really confusing, even for experienced advocates. The processes are a little bit different.
Looks like Ellie's having some technical issues, maybe. Hey, Ellie.
Yeah.
Are you able to hear? Do you want me to go over the objectives, and are you able to like maybe move close to your router or something? I think there might be some Wi-Fi issues or connection issues. Yeah, it's it's totally, Alicia, it's the government trying to take us down. They don't want us to talk about how to build power. That's exactly right. I'm not sure if Allie is able to speak right now.
Hey, I'm not sure if that's any better. Is it?
That's good. Yeah, that's great.
Okay, great. I'm so sorry about that. I think I did hear the part about the government taking us down, so that may be it. But hopefully these objectives have been up there so you could read through them. Basically, we just want folks to go away with a knowledge of what the agencies and offices are that affect HIV in law and policy, to understand laws and to recognize areas Okay, so just of what we'll be doing today, we're going to have an executive branch overview.
So, Ellie, we're not able to hear you. So why don't I go over these and let's see if maybe you could call in on a phone line or something for the sound. So I think basically the agenda for today, and again, thank you all for joining us and sorry for the technical difficulties. Ellie's going to go over a really incredible overview of kind of like what the executive branch looks like and federal agencies within the administration so that we all really understand, kind of like how HIV policy is shaped and formed, where decisions are made, who's making them. And Ronald is going to be giving us a case study on some efforts that have been made by the HIV community to work on the Ryan White program in the past and basically make it increasingly responsive to community. I will also do a case study on some of the organizing and advocacy that was led by women living with HIV and trans folks living with HIV around the National AIDS Strategy, National HIV AIDS Strategy back in the Obama administration. And these are just as sort of examples to give us some food for thought about how we as a community can be organizing moving forward. And then we'll talk a little bit about how to get involved, and we'll have plenty of time for questions and discussion at the end as well as throughout. And so even though folks are muted, we want to definitely invite you to chat in on the chat box with any comments or questions you have, anything maybe that you're trying to move or working on. We'd love to hear that. And again, just an invitation to introduce yourself on the chat if you haven't already. It looks like we have an amazing group of folks here today. So I think we may have lost Allie, so I'm going to go ahead and try to share the slides. Cool. Are you all able to see those slides?
Yes.
Okay, thank you so much. I'm going to go into presenter mode. Great. So, yes. So I think next I'm going to turn this over to Ronald to walk us through a case study of the 2009 Ryan White reauthorization.
Thanks, Nana, and thanks to PWN for organizing today's webinar. This is really a very important topic in which we need to be engaged. And I want to start with a case study of the Ryan White CARE Act reauthorization. Next slide. The last reauthorization of the Ryan White legislation was in 2009. The Ryan White CARE Act had been reauthorized 3 times prior to 2009. The original act itself, the Ryan White CARE Act, was passed overwhelmingly in Congress in 1990. And I want to pause here to say that process itself was a good example of the role of HIV advocacy. HIV advocates at the time were instrumental in drafting the Ryan White CARE Act, including large sections of the legislation were actually drafted by HIV advocates. And it also reflected the close relationship with Congress and the importance of having congressional champions. And in terms of the Ryan White legislation, there was probably no bigger champion at the time than Senator Ed Kennedy. And advocates worked very closely with Senator Kennedy's office. Also, needs to be recognized the role of Senator Orrin Hatch in passing the original legislation. Some of us know or heard of Senator Hatch in the last days of his tenure, where he was a bit of an obstructionist, but it's also good to know the long-term legacy, that the kind of bipartisanship that existed that enabled us to pass the Ryan White CARE Act originally. And again, the role of HIV advocacy in passing the CARE Act. 3 reauthorizations. And looking at the 2009, that is the last reauthorization and the process, I want to highlight that within the HIV community, the 2009 reauthorization was the least contentious of the reauthorizations. And I say least because not that it was contentious. We had lots of debates, but it paled in comparison to some of the previous presentations, which were really, I'll say, bloody in terms of the kind of intra-politics within the HIV community. And I should really pause here to say what I should have said at the start, that I'm speaking from a personal perspective. I was involved in one way or another in all 4 reauthorizations. And in 2009, I was working at AIDS Action Council then, which preceded AIDS United. So I just want to acknowledge that I'm speaking from a personal perspective of having been involved. So, and I say the 2009 process was the least contentious. And there are a number of factors that contributed to that, which I think we need to highlight when we look at the overall process and federal process. One is the political environment in 2009. It was the new Obama administration, so we had a friendlier administration than we had in the previous 8 years. And the Democrats controlled both houses of Congress. So we had champions in leadership positions. I mentioned Senator Kennedy, but in the House, we also need to recognize the championship of Representative Henry Waxman, certainly of Representative Pelosi, then Representative Pelosi, and other champions in the House, which made the political environment a very friendly process. Also helping the Ryan White reauthorization and being a smoother process within the HIV community was that there were other issues that the HIV community were also working on at that time. Big, important issues, including the development of the National HIV/AIDS strategy. And again, HIV advocates were instrumental in the development of NHAS, and Nana is going to talk more about that. But that was part of the background that made work on the reauthorization of Ryan White easier. Also, need to acknowledge the FAP Ryan White Working Group, which, in my opinion and my view, was really the fulcrum of the process and driving the process forward. And also, and I'll come back to that a little bit more, but the last factor that I want to highlight, particularly for this overall discussion on the federal agencies and the federal process, was the sunset clause. The 2006 reauthorization had a sunset clause, and that meant that at the end of the authorization period, which was September 30, 2009, the sunset clause was stated that if the bill was not reauthorized, the authorization, the program ends completely. So at what we were facing in 2009 was the possibility that if we did not get the Ryan White law reauthorized, the program would end. The sunset clause stated that if on September 30, 2009, the Ryan White Care Act is repealed, that would have ended the program. So that prospect was there. So we knew as advocates, we knew we had to do something. We had to get this reauthorization done. So that sunset clause was a threat, but it was also a strong motivator for us to get our act together and work with Congress to get the law passed. By 2006-09, the Ryan White program had well proven itself to be vital to us. Next slide. So I think what I will come back to the Ryan White Working Group, because I think that was a major part of the process of advocacy and driver, and the process, which was 2 years. I mean, I also want to highlight that this was not a last minute rush job. We had been discussing reauthorization for the previous year or so. So in 2008, or perhaps even earlier, we began focusing on the Ryan White reauthorization and what we had to do. We knew we wanted to avoid some of the pitch battles that we had in previous reauthorizations. And again, we knew with the sunset clause, it was vital to us. So that the Ryan White Work Group, and want to acknowledge the co-chairs of the Ryan White Work Group at that time, Bill McCall and Ann Leffert, and they shepherded, with the involvement of many segments of the HIV community, to the development of a consensus statement on the future of the Ryan White HIV AIDS program and the law. And over 300 organizations across the country signed on to the statement. So that process was really engaging all segments of the HIV community from across the country and coming together on an agreement, which we were able to take to Congress and say, this, we have 300 plus organizations, we have the community solidly behind us as we advocated in Congress for passage. Another aspect, an important aspect, was that the statement contained minority viewpoints. We allowed differences to be aired, acknowledged, and put into the process. Yes, this was the majority view, but here are, right in the document, was the statement of people who had different point of view. So the respect for differences and differences within the community was built into the consensus statement. So, and that enabled us to move forward. Next slide. But also, I want to highlight, particularly for going forward, that one aspect which I think was disappointing in the 2009 reauthorization, that there was not a strong collective unified voice of people living with HIV. The then NAPA, the National Association for People Living with AIDS, was at the table, but they were not a strong presence. There was not strong leadership. And I think we have, to looking at the history, we have to acknowledge that that was a factor and need to see how we can not repeat that as we go forward with our advocacy. Also, looking at back, we have to realize that there has been no reauthorization of the Ryan White legislation in 11 years. And that is despite dramatic changes in the landscape of HIV, which I think all of us on this webinar today are aware of. The 2009 reauthorization was before the release of the National AIDS Strategy. It was before taking really the results of the advances in HIV treatment that enable us to have the HIV continuum of care and the advantages of and realizations about treatment equals prevention, you equals you. All of that has been since the Ryan White reauthorization, not the least of which we are now have the ability, the knowledge, and the plans to end the epidemic. That was not the case in 2009. So I'm saying that to say that the legislation that we have now is antediluvian in many ways, in the sense that it does not take into effect all of the kinds of changes. And the Ryan White program is still going and serving strong, but there are issues that need to be addressed, certainly in my view, that the legislation did not exist because those conditions did not exist at the time the Ryan White was reauthorized. The last thing that I want to say is looking at the role that the collective voice of people living with HIV, in my view, did not play in the 2009 Ryan White reauthorization, really raises the question of, does the community of people living with HIV, do we have the will and the collective capacity to engage in and give leadership to a re-examination of the law that authorized the Ryan White? And indeed, the kinds of issues that we'll be talking about throughout this webinar, and the federal agencies and the processes, do we have the capability to be meaningfully engaged in that? And I want to say, when I say the collective voice, recognize that people living with HIV, including myself, were very active in the 2009 reauthorization. So it's not as if we as individual people living with HIV were not visible, were not involved. But I'm talking about the collective voice and a unified voice. And that's something that I think we really do need to look at. And it's so helpful that we have this webinar today that enables us to look at the kinds of the executive branch and have a deeper understanding about the structure and the nature of the federal agency so that we can better inform our advocacy and make our advocacy more effective. But we really have to look at also, do we have the will, do we have the collective capacity to engage with the federal agencies the way we need to be engaged in order to make sure that our needs as people living with HIV, as the needs of people affected by HIV are realized. So again, thank you for giving me this opportunity. And as we go through this webinar and hear everything that we will hear, that we'll have a robust discussion towards the end.
Thank you so much, Ronald. And what a powerful way to start us off. You know, we are all so lucky as a community to have benefited from leadership of Ronald Johnson and others who have been really working to make sure that the needs of people living with HIV and of communities most impacted by the epidemic are addressed in these legislative processes, in these processes of working with federal agencies. And sometimes those things are very connected, as I think Ronald really highlighted. And so, you know, now kind of moving into potentially another reauthorization, we're in this moment where we have a huge opportunity to build on all the learnings that have come before and, you know, really try to make this program better. And this is a program, the Ryan White program, that directly benefits many of us. You know, this is the program that serves about 500,000+ people living with HIV in the United States. It's really effective, it really works. And potentially, you know, there are things that could be made better and more aligned with current practice. So I'm going to go ahead and turn this back over to Allie, who has rejoined us. Thank you, Allie. And I can move the slides for you. So Allie, you're muted. We're not hearing you. Let's see. I think you just need to unmute your phone.
Nana, I'm still having, sorry, I'm still having some issues.
Okay.
Could you unmute my phone?
Can you mute your other line? Okay. Do you want me to mute your phone or unmute it? It looks like it's unmuted already. You're unmuted on my end. Okay, hold on, everyone. Sorry about this. Sorry for the technical difficulties.
Can you hear me now?
Yes, we can hear you now. Thank you.
Okay, fantastic. I am not sure why that was going on, but we'll just do audio only. I'm so sorry about that. Just want to confirm, Nana, you're still hearing me, right?
Yes, I can hear you and I can move the slides, so we're good.
Okay, fabulous. Yeah, well, let's just start off then. I'm so sorry about all the technical difficulties. I'm not sure what's going on. So Ronald actually put us in the perfect transition to go into like an overview of the executive branch, which does the executing of all the laws. So everything Ronald just talked about with the Ryan White reauthorization program, when Ryan White was reauthorized by Congress, it then was implemented by the executive branch. So everything they worked on is now being executed by the executive branch, which is just putting into action what Congress passed. And that includes everything, including enforcement and things like that. So just to give a brief overview, the president is in charge of the executive branch. He's the elected official in charge, and that is now President Biden. And the vice president, Kamala Harris, is second in command. sitting below the president and vice president in the White House are the cabinet officials. These folks serve as advisors to the president, and they're heads of 15 of the executive agencies, which are just the federal agencies that we talk about, like Health and Human Services and Department of Justice and things like that. The executive branch is also made up of a lot of different departments and independent agencies and boards and commissions and committees. And so it can get really overwhelming. They are all set up for a specific purpose, like in the case of the CDC. Their mission is to protect the public health and safety through prevention and control of diseases. So there are a ton of different agencies that do everything under the sun. We're not going to discuss all of them today because I don't want to take up that much of your time, but we'll focus on some of the main agencies affecting HIV law and policy, how they do so, what their main programs are, and how we can influence them. So I'll go on to the next slide, please. So just to give you a little overview of how administrative agencies create policies, there's 3 main ways. We're mostly going to focus on way number 1, rules, but just so you know, there's also orders and interpretive rules. So next slide, please. So rules are generally applicable. So that just means they apply to everyone. They have a future effect, which means that they affect things that are happening going forward, not things that happened in the past. And they are designed to implement or interpret law or policy. So like in the case of Ryan White, something that went through and was approved by Congress with the reauthorization process, regulations were then likely made around that to help put that into effect. So just an example of this would be a regulation. Next slide. So with the rulemaking process, there always has to be, if you want to change a regulation, add a new regulation, or delete a regulation, there always has to be a notice and an opportunity to comment. And those 2 things mean that basically they have to tell you they're going to do something to a regulation, and then they have to give the public the opportunity to respond to that. Before this whole process happens, there also has to be the decision to regulate, which is usually driven by the staff of an agency, the president or the White House, people who are involved in an industry. So it could be grantees, or it could be, like in the case of Ryan White, like clients, people living with HIV. So there's a whole bunch of people who can influence the actual decision to regulate as well. I am not going to go through all the details of this because I think it's actually going to be more helpful to just show you all the examples that I have on the next slide, so you can see what this actually looks like. So next slide, please. So this is an example of notice. So you can see here, this is a recent notice that just went through about changing the Title 10 program. So notice requires an agency to basically state the legal authority for the rule. So that's the law that Congress enacted, saying, this is what gives me the authority to make a regulation in this area. It has to explain how to comment on a rule. So you see on this green button on the top that says submit a formal comment. That would, if you click on that, it brings you to explain how to submit a comment and how to do the whole process. So it has to tell you how to actually comment. If you were to scroll down on this, it explains basically what the rule is. So it's called, like the subject matter that it's addressing, what it'll do, what the effects are. All of those things would be included in the notice. And it also has to disclose important data and scientific studies relied on in formulating the rule. So a lot of times that's basically what led the agency to make this change. Usually there's some type of evidence that they think that this will make a program better, and they have to tell you what that is. And that's really important because then you're able to challenge that if you think maybe that data or scientific study isn't actually the most sound. Next slide. So this is an example of a comment on the left side here. And a comment basically is from the public, and the agency is required to both receive these, so it has to have some type of process. It could be, sometimes it's an email address, sometimes you do it on a website, but they have to be able to actually get the comments from the public, and anyone can submit a comment. So they have to be able to do that. And then they also have to actually consider these things. As you can see here, the commenter had an objection to the rule, which is, it was about incorporating the Violence Against Women Act into the Department of Housing and Urban Development Program. Basically, you're not allowed to deny someone housing on the basis of them being a victim of domestic violence. And so they were trying to incorporate that into the rule, and this commenter had an issue with, you know, how they did that. So when the agency is adopting the rule, they actually have to respond to that comment, just saying why they're still adopting it or any changes they're going to make because of the comments. So here you can actually see that they changed this rule based on this comment that was made. So they responded to it, and then they said, that's actually a really good point you brought up. We're going to change the rule. So this is kind of an example of why commenting is important, because the agency does have to consider it and respond to it, and sometimes even change things. Next slide. So this is orders. We're not going to focus too much on these because it usually is affecting individual rights for the most part, not always, but it's basically anything other than a rule is an order. So for example, if you were to face some type of discrimination in the workplace and you filed a complaint based upon that with the Equal Opportunity Commission, you'd file it. The EEOC, as it's called, would investigate it and come to a determination. That determination is an order. So that's something else that agencies do. But like I said, we're not going to talk too much about that today, but I just wanted you to know that it exists out there. And then next slide. All right, great. So then interpretive rules or guidance is another really important way that agencies affect policy. So after an agency passes a regulation or even Congress passes a law, agencies might put out interpretations of either their regulation or the new law. And, you know, it can give you a little example of how to apply in a given instance or how to comply with the rule, all sorts of things like that. The important thing is it doesn't actually have to go through that notice and comment rulemaking procedure, so it can happen a lot quicker. But on the flip side, it also can't set new standards or impose new requirements. So there's some pros and cons to that, but it's definitely an important way that things are influenced in the federal government. And Nana, because of our technical difficulties, you can just go past the guidance example slide and we'll get right into policies. It's just a picture of federal registrar. So, okay, great. So there's two main government-wide HIV policies that we're going to briefly cover today. A lot of folks may have already heard of these, but I'd love to chat about them for just a minute. The first is ending the HIV epidemic, and then the second is the HIV National Strategic Plan. So these are programs that guide overall government action related to HIV, and right now at this time, it's really actually kind of unclear how they work together, which I'm just going to flag as an advocacy opportunity a way to get involved here, because it's not really clear how they're going to work together. So, and because they are guiding overall government action related to HIV, it's an important thing to consider. So next slide. So a little bit about the End the HIV Epidemic Plan. It's often referred to as EHE, and I'll refer to it as that throughout the rest of the presentation. If you've heard about the local plans or the statewide plans, they're often called ETE. just to make it more confusing with more acronyms. But it's an operational plan developed by Health and Human Services agencies, which we'll talk more about later. And it aims to end the HIV epidemic by 2030. And it focuses on these 4 pillars, which are prevention, diagnosis, treatment, and outbreak response. And there are lots of opportunities to influence how EHE exists. At the state and local level, you can definitely get involved in developing plans. Also, important opportunities to influence really any of the programs and the plans that I'm going to talk about today is budgets. When budgets are being developed, is a really important way. Advocacy happens with administrative agencies. And then, of course, meetings of advisory bodies, which I'll talk about all of that later, but just wanted to flag that this is how you could influence EHE. And the reason you might want to influence EHE is some of these main critiques that I have written down here. PWN and the U.S. people living with HIV PACHA have all put out a lot of materials about, some of the ways that the EHE plan could be improved. So right now, it doesn't have a lot of information about the social and structural drivers of health. It's reliant on MHS, which for those who don't know is MHS is also known as molecular HIV surveillance. It's the process of tracing networks of people living with, or tracing networks of HIV acquisition using genetic sequencing data. People living with HIV don't consent to having their data used or shared in this way. And there have been issues with confidentiality breaches. So there's also a lot of issues with criminalization and immigration. And if anyone wants more information on that, we can definitely provide resources. And so just drop questions in the chat and we'll make sure to provide those. Yeah, lack of meaningful involvement of people living with HIV. It doesn't include key communities. So all of those are some ways why you might want to influence this particular plan. Next slide, please. Okay, the HIV National Strategic Plan, also referred to, it was previously called the National HIV/AIDS Strategy. So you might have heard NHAS before. NHAS and HNSP are the same. It's just a new iteration of it. Looks like some of my information might be deleted here if it's the same on the one on my computer as the one online. But basically, it has a very similar goal of ending the HIV epidemic by 2030. And it's defined as reducing the number of HIV acquisitions by 90%. This is currently the 3rd iteration of the NHAS or HNSP. And they are 5-year national strategies that kind of dictate the federal HIV response. The current one we're in covers 2021 to 2025. And again, there's a lot of opportunities to influence this, both when they're being developed, but also now when they're kind of developing an implementation plan. And there's also been indications that the folks are interested in revising the plan that was developed under the previous administration to kind of suit this administration's objectives a little bit more. Next slide, please. And then, let's see. So these are some of the main executive agencies affecting HIV programs and policies that we'll get into now. Next slide, please. So we're going to be talking about first the Department of Health and Human Services. We're going to be talking about 5 of these agencies, and just like I said before, giving a brief overview. ONASH, you'll see on my little chart here, is off to the side. That's because it's actually really coordinating the response of the other HHS departments. It does the project management, essentially, of the Ending the Epidemics plan for the other HHS agencies. So that's why it's off to the side there. One that we're not necessarily going to focus too much on today, but I just want you to be aware of is NIH, which is the National Institutes of Health. It's the largest and most significant public investment in HIV/AIDS research in the world. I'm not going to really discuss it further because it's a little bit more technical than we're going to get today, but I do want you to just know that it exists and is there. Next slide, please. Okay. So the Office of the Assistant Secretary of Health, like I said before, it runs the, oh good, okay, now I can see again. It leads the EHE program, so I'm not going to go into all of that again. One other thing I'd like to call out that it actually does is it runs the Minority HIV AIDS Fund, which improves prevention, care, and treatment of racial and ethnic minorities living with HIV. So it actually funds different programs and activities. Right now there are 33 of them that it's currently funding, but it's grants that are given to different either governmental agencies or nonprofits to really reach out to you know, folks who maybe aren't addressed in some of the other plans. Next slide, please. So then Centers for Disease Control and Prevention, I'm sure everybody knows about this after COVID-19. We've heard a lot from them now. So in terms of the HIV response, CDC has a big focus on prevention, which can often manifest itself in a lot of actions that are harmful for people living with HIV, which gives us a lot of opportunities to actually, you know, advocate there. So some of these strategies that it really focuses on are MHS and other forms of surveillance. Sometimes it can really use some stigmatizing language and fail to consider the well-being and quality of life factors for people living with HIV outside viral suppression. So there are a lot of opportunities with the CDC as well for advocacy. Next slide. Okay. So just to orient ourselves, we are still in HHS. All the things I just covered are still in the Health and Human Services Administration. I'm going to cover three programs, I suppose, 2.5, that are within the Health Resources and Services Administration, HRSA. So there's the Health Center program, and then within the HIV AIDS Bureau, there's Ryan White, which I'm sure y'all are familiar with. And within Ryan White, there's a set called the AIDS Drug Assistance Programs, ADAPs. So that's where we are here. All right, next slide. Okay, so quickly, the Health Center program is a grant program managed by HRSA. It basically funds grants to community or to health centers that are like community-based, patient-directed organizations. And one of the reasons these are really important is because they serve low-income communities and also a lot of rural communities where these primary healthcare services wouldn't otherwise be available without the existence of these programs. They also do HIV testing and increase access to PEP and PrEP and things like that. But these are grant programs that are managed by HRSA. So next slide, please. Okay. I'll kind of just briefly cover some of the advocacy because we did just talk quite a bit about Ryan White, and I know we are running short on time with all of our technical difficulties. So some ways, so basically Ryan White is a federally funded program, but it provides grants to states, cities, counties, and local community-based organizations. Some of those grants are provided to places where there are planning councils, and these planning councils can make decisions about how to allocate resources within their jurisdiction, their city. And planning councils are supposed to reflect the local demographics and include people living with HIV. They're supposed to have 33% or more people living with HIV included in a planning council. So it's actually a really great way to get involved in like a federal program, but on a local level. Next slide, please. Okay, so the ADAP programs are also part of Ryan White. It's not separate, but these provide medications to folks living with HIV and can also do some help with purchasing health insurance and things like that. They're funded by grants, but then run by states or territories. And this is another opportunity for involvement where it is a federally funded program, but there are more opportunities for state or local advocacy along with them. Actually, the PWN Texas Strike Force has a lot of experience with this now in terms of advocacy around ADAP programs and making sure they're really like working for people living with HIV that they're supposed to be serving. So that's another opportunity for involvement, is getting involved like that. Next slide, please. Sorry, I'm rushing through these. I just see that we're short on time, but so CMS is the Centers for Medicare and Medicaid Services. Two main programs that I'm going to talk about. Basically, if you are interested in healthcare for people living with HIV, these are two of the main programs that are sources of healthcare for people living with HIV. You can see on my slides here that Medicaid is the single largest source, and 30% of all federal funding on HIV care is actually spent through Medicaid. Medicare is another federal health insurance program, and about a quarter of people living with HIV get their health insurance through Medicare, which is a huge portion. And the primary pathway for people living with HIV to access Medicare is through Social Security disability insurance, which is basically to say it's that second route, it's that permanent disabilities route. So if you are interested in healthcare and want to make a big change, there's obvious pushes for legislative changes in healthcare, but if you want to make some regulatory changes and for people living with HIV in healthcare, this can be a good avenue to do it as well, because there's all sorts of things that like Medicaid and Medicare could provide for people living with HIV and improvements that could be made to the programs. So to really provide a little bit of healthcare services for folks. So that's another thing to look out for if healthcare is your place where you like to be involved. Next slide. We are finally out of the Health and Human Services Administration. So we are now in the Department of Housing and Urban Development, which does a lot more than the one thing I have up on this slide. I want to make that really clear. There are so many programs that are in HUD that people living with HIV can use, from rental assistance to housing vouchers, all sorts of things like that. So there's a lot of opportunities there as well. I just wanted to call out the one program that's actually specifically allocated for people living with HIV. And that's, you'll hear it referred to as HAPWA. I like to say the acronyms because when I first started, I had no idea what the acronyms meant. So I was like, well, what does that mean? But it's housing opportunities for people with AIDS. I'm sorry. And so HUD makes grants to local communities, states, nonprofits, cities, things like that, for projects that benefit low and no income people living with HIV and their families. And so this is another opportunity where they have a formula where they make grants, and then there's that the funds are actually fairly flexible. So they do provide like housing and things like that, but the way in which it does so is flexible, and it's a really great program for that reason. So, okay, next slide. So moving right along, we're also, again, in a completely different department of the federal government now. So this is the Department of Justice, and sometimes folks think about the Department of Justice as just the really like prosecutorial wing of it, the criminal space. However, it also has a civil rights wing, which is what we're talking about here when I'm talking about the Department of Justice. So the Department of Justice actually leads investigations of discrimination against people living with HIV under the Barrier-Free Healthcare Initiative, the Fair Housing Act, and the Americans with Disabilities Act. And obviously, the degree to which these investigations happen changes administration to administration. But if you're really concerned about discrimination, you could elevate those concerns to DOJ, and that's an entity that, through their civil rights wing and things like that, they conduct investigations of, maybe companies that are not complying with the ADA or folks who are being denied housing based on their status. So it is important. The other thing I'd like to note is, although it may not be the gold standard for those of us who want to see HIV decriminalized, they do have a best practices guide for states to reform HIV criminalization laws to align with science. So it's more of like a modernization rather than a decriminalization, but it is something for folks interested in decriminalization. It is an interesting resource. Next slide. Okay, and this again is a completely separate department. It's a completely separate agency. So it's actually an independent agency, which the difference doesn't really matter for our purposes, but it's not a cabinet official who runs it, basically. But there's two parts of the Social Security Administration that people living with HIV might access. The first is the Supplemental Security Income, which is financial support and resources to folks with disabilities, people with low or no income, older adults as well. And then the Social Security Disability Insurance, which provides benefits for people with disabilities. So an important thing to note is, like, although the Social Security Administration isn't directly paying or providing for HIV treatment and services, many people living with HIV can qualify for one of these two avenues to receiving Social Security insurance or income. And it can be a really important way of, like, paying for other living expenses to support health, well-being, and just, like, overall quality of life. I mentioned a little bit earlier about how many people living with HIV, that quarter of people who access Medicare, actually do so through Social Security disability insurance. That's this avenue right here. So it ends up being a really important way that folks can get health care and also just provide basic living expenses so that they can have, like, a higher quality of life. So it's a really important thing as well. Okay, next slide, please. So just some other important programs. These are in, I guess I should have put temporary assistance for needy families up in Health and Human Services. It's run through the department. It's run through HHS's Department of Children and Families. But it's a time-limited assistance for families with children when parents have other responsibilities and cannot provide for the family's basic needs. And there's also supplemental nutrition assistance programs, which helps lots of folks living with HIV purchase food. So, and that's run through the Department of Agriculture. But two other important programs that you should be aware of for that lots of people living with HIV access and use. A great way for advocacy as well if you are interested in nutrition services or, families and things like that. Okay, next slide, please. So we are getting towards the end of my presentation finally. The advisory bodies affecting HIV/AIDS policy. So these aren't necessarily sitting, these aren't necessarily making rules or regulations. They're advising all of those agencies I just went into about different rules and regulations that could be made to improve the programs. And we're going to talk about two of them, CHOC and then the Presidential Advisory Committee on HIV and AIDS, PACHA. Next slide, please. So PACHA provides recommendations, advice, information to Health and Human Services on different programs, policies, and research for HIV. It also provides comment and advice on the EHE and HNSP programs, which can be really important. Two important ways that I just want to highlight to actually influence PACHA is, the first one is PACHA has meetings. I have on here 3 times per year. I just really want to highlight that all of this stuff in the middle, the 25 members, 4-year terms, no requirement for people living with HIV 3 times a year, that's all part of the current PACHA charter, which can be rechartered by the new administration and likely will be rechartered by the new administration. And all of those elements are likely to change. And actually the rechartering is an opportunity to change it. So, you know, having requirements in there for people living with HIV to be members of PACHA, or for people living with HIV networks, back to Ronald's thing about the collective voice. So all of those things are subject to change, which is an opportunity for advocacy, but also when PACHA meets, there's opportunities for folks to submit comments on whatever. Usually they'll put out some questions that they're addressing during a session, and people can provide comments similar to those administrative comments that I spoke about earlier, but they don't actually have to go through the federal registrar. So next slide, please. So CHOC is this very long name, so folks refer to it as CHOC. And it advises the Health and Human Services Secretary, Director of the CDC, HRSA administrator on different objectives, strategies, policies, and priorities for HIV prevention and treatment efforts, viral hepatitis and STD prevention as well. Again, I really just want to highlight that this can also be rechartered and things may change, which is a really great opportunity for advocacy, and lots of advocates are currently working around that. So, and the great part about PACHA and CHOC is they influence all of the HHS programs that we talked about, because they're providing advice on how to do different things within there. So it's a really good opportunity for advocacy. Next slide. Okay, so the Executive Office of the President, what is that? So this provides the President with help and support in making decisions that he or she will need to govern effectively. If you've heard about like the Chief of Staff, he is within the Executive Office of the President, and then there's also different like policy councils and things like that that are part of the Executive Office of the President. Next slide. So under the Obama administration, there was ONAP, which was the Office of National HIV and AIDS Policy. This was part of his Executive Office of the President. ONAP was at that time part of the Domestic Policy Council. It's not required to be, but at that time it was. And it coordinated, the HIV response at the federal level, essentially, or at the presidential level. So if Obama needed to make some decisions about his federal response to HIV, that was what ONAP was there for. You can see here it became defunct under Trump, and it has not yet been reestablished. But that's another important opportunity for advocacy, because it may be reestablished, or folks can push for it to be reestablished as well. So with that, I'll actually turn it over to Nana. I think she's going to give us a little case study as well.
Sure. Thank you so much, Allie, for that very comprehensive overview. And just so folks know, that was just, a taste of all the different agencies and bodies that are influencing HIV policy, as Allie said. And we are working on a fact sheet that's also going to be coming out. We know this is a lot of information. So there's also going to be a fact sheet that will be released by PWN in the near future that will kind of like, summarize a lot of what we heard today. So I'm going to just talk a little bit about some work that was done also as another example of a case study in terms of how advocates work to influence the national HIV/AIDS strategy. And I'm specifically going to talk about primarily how women and trans and gender nonconforming folks work to influence the national HIV/AIDS strategy under President Obama. And so just as a little bit of context, some of you may have been around and might remember that in 2007, we were in a really, very robust and contentious kind of presidential election cycle. And there were a lot of different candidates running, kind of on both sides of the major two political parties, as well as some other parties. And one of the things that the HIV community broadly started to organize around was basically saying, in this new administration, whoever it is, right? Remember, we were coming out of the George W. Bush administration. In this administration, whoever it is, we want a commitment from the president to create a domestic plan to address the HIV epidemic. And this was really an accountability measure. The US had been requiring other countries to have these plans in order to receive US funding through the PEPFAR program for many years. So receiving PEPFAR funding, the President's Emergency Plan for AIDS Relief, was actually tied to being able to show that in these countries there was a plan, but yet there was no similar mechanism in the US for accountability around where resources go, how they're spent, what is the plan, how is the plan designed to reach communities that are really vulnerable and impacted? Is it even visible or transparent? And so there was a really, kind of like an organized national call happening. And what it led to was, it was a very successful call. It was basically a coalition for a national AIDS strategy that formed, and asking the major presidential candidates to sign on and say, yes, if elected president, I will develop a national AIDS strategy for the United States. And so the community was successful in getting those commitments from all three of the major candidates at that time in the 2008 election cycle. And so when President Obama won the election, one of the things that folks were working on as organizations was basically follow up with the new incoming administration, or rather with the transition team right after the election, to say, okay, you committed to this national AIDS strategy. Now here's what we want to see for people living with HIV or for the HIV community. And so many different organizations wrote recommendations, submitted them. That's the same thing that happened, this time around. It happens every cycle. It also happens, by the way, when you have a new governor, or even mayors have a transition team and start to meet with key stakeholders in the community about issues. And so a lot of organizations go to them and say, here's our list of priorities at that time. So this is something that you can do at any level of government. But so one of the things that Positive Women's Network did is, well, we said, who's writing something for women living with HIV? When we asked around, nobody was working on that. So we basically put together our own recommendations. And PWN was really new back then. We had just formed in June of 2008, very grassroots, no staff, all volunteers. But we basically convened women living with HIV over, over conference calls for hours and hours around the country and in our communities and things like that, and put together a set of recommendations that we then submitted to the transition team along with everyone else. It wasn't the most elegant set of recommendations that's ever been put together, but to my knowledge, it is the first time that set of recommendations had ever been written, authored entirely by women living with HIV in the United States and submitted to a sitting presidential transition team. And so they received it, they had it in their binder with all the other transition team documents. And when they started to hold meetings with the HIV community later in November of 2008 after the election, but before President Obama took office in January of 2009, we were on their list of one of the organizations that was invited to those meetings because they had our document in their binder. And so that was, kind of how we began a relationship with the incoming administration at that time. Also, a number of women and HIV organizations were getting together to basically, start to look at recommendations around HIV policy at the federal level, but also this was the whole time frame where there was very much a conversation around healthcare and the Affordable Care Act, what came to be the Affordable Care Act. That President Obama was also working on and had committed to. So really, we were looking at all of that within that context. So the Obama administration had committed to and developed their national AIDS strategy that was released for the first time in July of 2010. A number of community groups had already put forth recommendations. The next step was, as women and gender advocates, we basically looked at what had come out from the administration and said, we're analyzing this to see how well it met the asks from the community on behalf of women and trans folks living with HIV and impacted by HIV. And so this group of organizations that you see logos of here on the right-hand side basically put out kind of what was almost a report card of the national HIV/AIDS strategy, analyzing it and recommending some next steps on implementation. And we actually graded it in all these different categories. And I think overall we gave the strategy a C+, because we thought it made some important progress, but there was a lot of room for improvement in a range of areas. And one of the areas we were really concerned about and hadn't seen in the strategy was there was no focus on sexual and reproductive health at all. There was one mention actually of increasing HIV testing in Title X programs, but there was no sort of attention to the sexual and reproductive health care needs of people already living with HIV. And there was not a lot of information about stigma. There was no language around trauma or violence that we were starting to see a lot of data, and we already knew in the community anecdotally, we're really having a devastating impact on women and very much intersecting with the HIV epidemic for women and for transgender people. And so we started to do some advocacy and organizing around this. And one of the things we were able to get was a PACHA meeting focused on women and girls. And so PACHA does, PACHA was mentioned earlier by Ali, the President's Advisory Council on HIV and AIDS. It's actually misnamed. It actually advises HHS, not the president directly. But PACHA tends to focus on different themes, different topics, different aspects related to the domestic HIV response. And so, and at that time, it was also serving kind of as a monitoring body for the National HIV/AIDS strategy. And so PACHA was focusing on various things. We had a PACHA meeting focused on HIV criminalization, for example, because there wasn't a lot of attention to HIV criminalization nationally at that time. And we really wanted to elevate that issue. So we also we asked for a PACHA meeting focused on women and girls to really kind of uplift some of the nuances and gender issues that we felt were lacking in the strategy. So it took a while to get that. We were able to get that meeting to happen in 2012. And the community organized, and this was a broad coalition of women and HIV advocates organizing under the 30 for 30 campaign, the National Women and AIDS Collective. You can see Linda Scruggs here speaking at that PACHA meeting. So basically, we were all presenting kind of different perspectives on what was needed, but a unified collective voice, as Ronald talked about earlier, in terms of some of the things we really wanted to see. And so this was in March of 2012. Later that month, kind of as a result of a bunch of different things we had done, including that meeting, but not limited to that meeting, we secured a federal interagency work group on the intersection of HIV, violence against women and girls, and gender-related health disparities. And this is because we had really focused our attention on looking at the fact that, women with HIV suffer the impacts of intimate partner violence, childhood sexual assault, post-traumatic stress disorder, complex post-traumatic stress disorder at rates that are much higher than the general population of women. And we really needed a federal strategy that accounted for this and that addressed things like trauma-informed care, which wasn't at all in that initial strategy. And so we were able to get a federal interagency work group on this, focused on this issue, to be set up. And what that means is basically, this was a work group that had representation from different agencies, like the ones that Ali laid out, different agencies across the federal government, and sub-agencies as well, that was kind of meeting and looking at how they could improve programs. How could they integrate, for example, in the Substance Use Abuse and Mental Health Services Administration, SAMHSA, how could they strengthen services for people living with HIV within that, within the programs that they're doing and the funding that they're providing. In HRSA, in the Ryan White program, what were opportunities to address issues around violence and trauma and connection to services to help people survive and get out of violent situations? So those were the types of granular questions that folks were looking at, as well as what's the research agenda on this, through NIH. And so there was a working group established. That working group ended up working throughout the rest of the Obama administration and produced their first report in September of 2013. And so this is all during the timeframe of the first national HIV/AIDS strategy, which had been released in July of 2010, which was set to expire in 2015, and which had no language, zero language around violence or trauma as they impact people living with HIV. So one of the recommended actions that the interagency federal working group came up with was to develop, implement, and evaluate models that integrate trauma-informed care into services for women living with HIV. And so, you know, of course, we were happy to see that. This was also an update that went into the next iteration of the National HIV/AIDS strategy when it was updated and revised for 2015 to 2020. And so that new strategy had some improvements in these areas. And so, of course, we were glad to see those. And you can see Gina Brown from New Orleans here, who was a PACHA member, as well as Cornelius Baker, who was also a PACHA member, you know, who kind of advocated on a lot of these different issues. In the new updated strategy, there were a couple of different outcomes, like measurable outcomes and metrics that specifically spoke to this issue. And sort of like demanded and set parameters for accountability on it that I've highlighted here on this slide. So I'm going kind of quickly because of time, but just in summary, you know, we used a bunch of different tactics to move this particular priority. We used comments, you know, comments to programs when the Federal Register notice would come out, and we were invited to submit comments. This was some of the things that we would comment on and mobilize others to comment on. We had folks coming to testify at PACHA meetings. We also organized panels at PACHA meetings with key leaders and stakeholders. We had a number of PACHA members that were, you know, kind of building their understanding around these issues to be able to elevate them at PACHA. We had a number of meetings with representatives of federal agencies. We demonstrated when needed, like direct action when we had to highlight and elevate issues. We also worked with media to uplift some of these issues. And we also made sure that we had that we had folks who had, you know, letters behind their names, basically, who were able to kind of like legitimize in a different way some of the demands that were coming from community. Because, for example, for many years we heard there's no data on the impact of violence on women living with HIV. And we were like, but what do you mean there's no data? Like, we're literally watching people die because they've been, like, you know, harmed, abused, pushed down the stairs by their partners. But you're telling us that there's no data, this isn't in the literature. So we found, we started to work in collaboration with researchers who were actually looking at this and who partnered with us on press conferences and briefings and things like that for the federal agencies. And so those kinds of alliances were really helpful in moving our priorities on the National HIV/AIDS strategy. So I'm definitely happy to answer any questions about that. I went through it all very quickly, but just wanted to give folks really a sense of the diversity of tactics you can use to move your priorities within an administration and with the executive branch. Turning back over to you, Ali.
Hey, hopefully y'all can hear me now. So I definitely want to have an opportunity for folks who are on to ask any questions that they might have, or to just, you know, discuss things if they'd like to. So Nana actually just did a really great overview of the different ways to get involved, and I think we've kind of highlighted these throughout the presentation as well. So I want to just leave a moment in case anybody would like to jump in here with, you know, questions or comments or anything. This would be an awesome time to do it. And if you don't want to unmute yourself or anything, feel free to drop it in the chat box or the Q&A box. And of course, ask us questions about these how to get involved pieces as well, if you have them.
And if anyone wants to raise a question verbally, I think if you, raise your hand, we can also unmute you.
Yeah, awesome, perfect.
Okay, cool. I see Angel. Angel, I'm going to go ahead and unmute you right now. You're unmuted. Angel, I think you might have to manually unmute, but I did give you,
Can you hear me now?
yes, we can. Hi.
Okay. So I'm saying, hi, everyone. I've been gone for a while due to mental health. I'm dealing with HOPO right now. So this is a really good first webinar to be on. What I'm finding is they do have resources for me in a mental health community and different things so I can focus on myself. What seems to fall back on me now is all that funding is no good to me because I have a criminal background, which is due to fighting my way through having HIV since the early 90s. So, I mean, I appreciate this, but I just wanted to put that out there and say, you know, it's another roadblock in my way, but I'm never afraid.
Yeah, thank you so much for lifting that up, Angel. And I think that's what you're raising is really important. There are a lot of discriminatory policies that keep people out of, you know, housing programs, employment programs, nutrition programs for having a history of interaction with our, you know, the criminal legal system in this country. And that is a great opportunity also for advocacy in terms of how to get involved. I don't know if Ronald or Ali want to speak to that at all.
Did you mute me back?
Yes,
I'll mute you, Angel. Yeah. So yeah, I think that is a big concern because those criminalization concerns are not just with you know, HAPA and other housing programs, but they also go to like food assistance programs and some of those other things as well. So it is a huge opportunity for advocacy. There was a question in the comments that I just want to uplift in case Ronald or Nana have anything they'd like to say about it. It's just like, how do you get involved? Do you go to the website of the organization or institution that you're interested in? I have some ideas on this, but I'll let Nana or Ronald go first. They're the experts.
I did call the people I'm sorry, this is Angel. Can you hear me?
yeah, we can hear you.
So I did call the people I applied for and put in the application today. And then when my case manager brought this up and said, well, you're not going to be allowed. I said, well, that's hardly even makes any sense when you don't look at the person as an individual as opposed to that. So I called the place that I applied for and asked them to please meet with me when they open my application. The best I could think of.
I think this is a good example also of the kind of tenacity you need to have in order to get on these planning councils. And I think it's a call to many of us that we need to make the process more explicit. People don't know the levers in their local communities about that, and and recognizing that they vary from community to community, state to state. So I think overall, I think we need more to get out more information on how to apply to planning councils. It's unfortunate, or advisory bodies. It's unfortunate that those bodies don't always make it easy for us to, for people to apply. So the question is really an important one because we need to get on those bodies. And when we need to recognize how much influence they in fact play. So thank you for raising that question. And we as leaders and organizers need to be a little bit more conscious of how to help people like this webinar, how to get involved, as the slide says, but we need that kind of hands-on assistance.
Yeah, and I would just also lift up that it is there are a lot of opportunities, and And it's also helpful to have support sometimes, even once you're there. So I know for me, for example, when I was on PACHA, I was brand new to being in any kind of space like that. And one of the things that was most helpful to me was finding other folks who had experience, mentors who were also serving on PACHA, or finding other people to talk to who had experience being effective in these kinds of advisory bodies, because it can be, whether it's like a federal advisory body or a local planning council or anything like that, it is, a lot of times those meetings are not set up in ways that are very accessible. Like the processes can be deliberately kind of like opaque and not that easy to track or follow or understand how to really have an impact. And so I would just like also invite folks to get on the list for Positive Women's Network if you're not on it, pwn-usa.org, HIVcaucus.org for the US people living with HIV caucus. Check out our social media pages, because we are constantly hosting different kinds of events, and you can connect with other advocates in those spaces as well. And you can just find them, even on our Facebook pages. You can connect with other people and be like, hey, I'm trying to figure this out. Can anyone help me? This is a very supportive community. And we do need to be, figuring this out with each other.
And I'll also say to just the comment in the from Lynn in the comment section about just like the process, I'd say exactly what Nana and Ronald have uplifted about getting involved with other organizations doing this work. But if you're specifically like looking for, say you're really invested in something like HAPA or something like that, or you want to know when PACHA meetings are happening or something, some of those websites do provide updates. So like you can get an update from PACHA every time it schedules a meeting. If you just go online and sign up for their emails, some of them are really easy like that. The other thing you can do, actually, Nana, if you go to the next slide, this might be helpful for this question. I hope this will help answer. So both the federalregister.gov and regulations.gov, like if there's a specific program you're interested in and want to get an update when they're doing some type of rule change, you can sign up for, different notices and things like that. Or you can check on there if you hear about something going on. So if you want to actually, find something that's happening, if that's what you're kind of looking for, Lynn, I hope this answers your question. These places are great too, but I think, yeah, especially signing up for like mailing lists of other organizations, because sometimes you'll sign up for all these mailing lists and then all of a sudden you're overwhelmed with all of this stuff and all of this information. And it's really helpful to have a good team or a good coalition of folks to work with. But in terms of the actual process of finding these things, here are some ways to do that.
And I want to, thanks, Ali. I really want to say something about the regulations. And when you go to these sites, be prepared for the fact that they are not written in everyday understandable English. They're very opaque, and you kind of need a lot of patience, but also I think that's another function of things that we need to do. We need to be able to summarize and put into readable English some of these regulations, because they do in fact impact our lives. Ali noted the kinds of regulations that affect the Affordable Care Act and the discrimination protections and the rules and how those rules change from administration to administration. We have to be able to read and understand them so that we can act on them. And just a way of warning, as you go to the Federal Register, it's difficult to read. And so don't be intimidated by the language.
Yeah, really good point. Thank you, Ronald. Ellie, did you want to say anything about this Federal Register slide?
Yeah, sure. Basically, I just put some, and I don't know, I'm sure I can disseminate these slides afterwards, because I know there's a lot of information that we provided you today, and some of it, we rushed through a bit, but I just put up some examples of the different websites that I highlighted in there. So when you're going through, that's what these things are. I know we're close to time, so I do want to ask if there are any other questions. I'd love to answer those now. Otherwise, I'm just so grateful for all of you for showing up today. I know it's a long webinar, but there's a lot of important information here. And yeah, please. Oh, I do have an evaluation I'd like to share with you all. If you wouldn't mind taking the time to do a short evaluation to help us improve some of the webinars and things like that we offer. I'm going to put it in the slides right now. So that would be fantastic. And yeah, please come join us, because we're doing lots of work and we would love to have you all here doing some advocacy stuff with us, especially disrupting. That's the most fun. So yeah, definitely contact us. I will put my email as well in the chat box.
Cool. Well, thank you all so much. Thank you. A special thank you to Ronald Johnson for making the time to join us and share his expertise so generously. Thank you, Allie, for such a great overview of the federal agencies. And everybody, please do stay in touch with us. We will have more content coming on this type of topic. This is going to be a multi-year organizing strategy to make sure that our community's needs are met in this administration and beyond. And we know that we're seeing the federal response on HIV become increasingly biomedicalized, as we have a lot of information about how to end the epidemic, which is like completely possible right now. What we know is that it's not actually going to be possible without addressing the social, the structural conditions that are impacting our lives and making sure that we have a human rights environment that is that really upholds our rights as people living with HIV and as communities most impacted by the epidemic, who are also impacted by racism and anti-Blackness and transphobia and homophobia and all of these other intersecting systems of oppression. And so we need and deserve a federal response that will work for all of us. And we're committed to work with you all to make that possible. So please stay tuned, stay in touch with us, and we're looking forward to throw down with all of you. Thank you so much. Take good care, everyone.